Hi, I'm Dr. Ceri Falys and I'm an osteoarchaeologist. So I study the remains of people from archaeological contexts. That means that I am a specialist in the human skeleton. I know each bone of the body and I know all the lumps and bumps and holes and grooves and why they're there and what they do. I'm talking to you today because I was part of the Cookham excavation team last summer when we found a cemetery. So I was there to help oversee the excavation of the skeletons, and now I'm following through the process of what we've done after the excavation and how we read the information from the skeletons that will tell us about their lives and maybe their deaths. So this individual, he is numbered 848. He was one of the first skeletons that were excavated in the summer. When we first discovered him, we realized that he was quite large. He seemed really tall compared to some of the other individuals, and he was just really interesting. He looked quite different than the rest. So during the analysis, we have had a chance to look at all of his bones. And we, obviously because he's quite big, we just naturally assume that he was perhaps a male. But looking at his bones, we can kind of confirm that that is likely what he was, that he was a man. So we can tell that he's male based on aspects of his forehead. We really focus on the eyebrow ridges, which are more pronounced in males than females. We look at in between the eyes, just at the bridge of the nose, and if it's more of a bump, it's more likely male, whereas females wouldn't have that pronounced bump. We can look at the back of the head. We can look at the musculature of the neck muscles. So you can see a pronounced bump here. That's called the nuchal crest, and if it's projecting, if there's a large bump, then it's more likely male than female. Looking at his mandible or his jaw, you can see he's got a very pronounced chin. But the most diagnostic bit of our skeletons that suggests whether we're male or female is the pelvis. And so if you look at half of his pelvis, you can see it's quite upright. Is quite narrow, which is a male trait. At the front of the pelvis, where the two halves join together, we're looking at the curvature of the lower ramus. And if it's quite V-shaped, it's male. If it's more U-shaped, it would be female. So that suggests that it will be a male. We can also look at this notch that sits right at the back of the pelvis. And if it's an acute angle or narrow, it's more likely male. Whereas if it was more broad or an obtuse angle, it would be female. So again, that looks more male. It's quite narrow. So all these indicators together, combined with the fact that he seemed quite big and strong and robust, it leads us to suggest that he was male. Once we know that the skeleton has fully matured and he's got all the teeth that he's ever going to have in his life, we start looking at bits of the skeleton that start to kind of degenerate or degrade as he gets older. So in archaeological skeletons, we can look at their teeth and how much wear is on like the biting surfaces of his teeth. And this just kind of accumulates over a lifetime of eating food with grit in it. And so we can see here on skeleton 848 that a lot of the white enamel has been worn away on his back teeth. So there's no enamel left on this biting surface. So that suggests that he's going to be over the age of 46 when he died. We can also look at the inside end of the collarbone, so the clavicle. This end here is the last bit of the human skeleton that will fuse as your body grows. And so that tends to fuse by the time you're 30. So because we can see that it's completely developed, we know that he was over the age of 30 when he died, And the fact that he's got little porosities, little holes, and it's quite a rough surface, we know that he was over the age of 46. He was probably somewhere between 46 and 60 when he died. But to also check, we have to check age throughout the entire skeleton, because how our skeleton records our age will vary based on the different regions. So we can also look at the pelvis. We can look at this funny little joint here. It kind of looks like an ear. That's called the auricular surface, and that is the base of where the base of your spine attaches to your pelvis. So over time, the surface can go from being a really bumpy surface to being very flat, and then eventually it starts to erode. So you get holes. It becomes more rugged. You get lots of lipping around here. So again, this suggests the individual was over the age of 60 when he died. And then the most accurate bits of our body that records age is again at the front of the pelvis. So we saw it when we were trying to determine the sex of the individual. But we can look at that surface where the two halves of the pelvis join together. And again, in young age, it's a very rugged, ridged surface. It then goes flat. And then with older age, it becomes eroded. And he's just on the stage of becoming eroded. So that joint at the front of our pelvis is, as I said, it starts to erode as we get older. So from a younger age, it's called the pubic symphysis. The joint is very ridged. It's got lots of linear ridges coming across. Then over time, those ridges, they start to flatten out, become less visible. It then becomes a flat, dense surface. And as we get very old, it becomes more rugged and eroded. So how we do aging is we'll compare our skeleton against these standardized criteria to get the best age estimate. See how that works. So once we decide which is the best fit, we then look up our number, compare it to an age. So in this case, the best estimate will be this. So it will give us an age of 61.2 with a range between 34 and 86 years at the time he died. So, combining all this information together, skeleton 848 was likely over the age of 46, possibly between 46 and 60 at the time he died. The next thing that we look at for osteological analysis is how tall they were. So for this we need a complete long bone. We really rely on the femur or the thigh bone. It's the most accurate. So we take our femur and we measure it on an osteometric board, which is basically a flat board with a ruler on it, and we try to get the maximum length. Once we have the maximum length, there's different equations that we can then plug the measurement into, and it will give us a rough estimate of how tall the individual was. So for skeleton 848, it was determined that he was about 5'10" in stature, which was quite tall for the time period. But now that we know the demography of our individuals, so we know that he was male, we know that he was older in age, so between 46 and 60, and we know how tall he was, so he was a bit taller than usual. We start looking for what isn't quite right with the skeleton. Is there anything perhaps pathological? So is there any sign of disease or anything else that's been recorded by his bones? So at the time of excavation, we did notice that there was a wound on the right side of his head. Hopefully you can see that there's a roughly rectangular shaped wound here with a bit of bone dangling inside the brain case. So this is what we call perimortem trauma. This wound doesn't show any sign of healing, so it happened at or around the time this individual died. In addition to that, there are 2 wounds to the back of his head. Again, they're in different shape than what affected this side, but they were quite forceful blows that go deep inside the bone itself. So that was quite unexpected. But then looking through the rest of his body during analysis, there's other evidence of perimortem trauma. We can see on his left shoulder, there's a big crack that runs across his shoulder blade, and that continues into the top of his humerus. So he's had a blow to his left shoulder, which has cracked the bone. The base of his forearm on the left side has also been shattered. So he's had some kind of forceful injury to his forearm. These tend to happen when you're defending yourself against a blow from an attacker. It's called a defensive injury. But his pelvis also shows evidence of these perimortem traumas. And there's also a fracture to his fibula, so the little bone on the outside of his lower leg. He's got huge trauma to both his head and his postcranium, so his body. Whether that was through an accident or a fight with somebody else, we'll never know. But we do know that he was quite injured at the time he died. This is individual 823. So this skeleton was the first one that was excavated on site in the summer. He was really interesting as we discovered him. I don't know if you can see from the photo, but usually when we find skeletons, the rib cage, you can see them coming along here, it kind of collapses down onto the spine. As the body decays in the ground and the soil pushes down. But skeleton 823, as you can see here, his right rib cage, it splays up. Now I've never seen this, and I haven't found any kind of comparable reference to this. We don't know why or how this has happened. We assume that there's some kind of pathology with his lungs. But so we were going to pay special attention when we did the osteological analysis to see if there was any reason for why his ribs could have done this. So we began osteological analysis as we always do. I know I always say he, but we need to double check the sex of the individual. So what does a skeleton say? Are they male or female just based on the shapes of their bones? So again, we check the forehead, we look at the eyebrow ridges. If there's larger bumps, then it's probably male, as you can see here. We can look at the mandible or the lower jaw. Again, it's quite broad. It's got a large protrusion where the chin is, which is more male. But it is the pelvis that is the most diagnostic when we're looking for sex. And so again, we're going to look at the greater sciatic notch. So if it's more of an acute angle, it's more likely to be male. And if it's more broad, it'll be female. So again, that's quite narrow, which suggests male. Again, we will look where the 2 halves of the pelvis join in the front. And we look to see what the shape is underneath where the 2 halves join. So if it's V-shaped, it's more male. If it's U-shaped, it'll be female. So that's quite a V shape. So the skeleton is telling us that they were more than likely male. Next, we move on to age at death. Again, we can see that all the long bones, they're fully developed. We can look at the teeth, and we can see that he has his wisdom teeth, his 3rd molars, they're fully erupted. So that suggests that he's over the age of 21. Again, we check the inside of the clavicle or the collarbone. It's the last bone in our bodies to finish developing. And so we can see it is completely fused and it's starting to kind of degenerate. So we know that they're over the age of 30. We always move down to the pelvis again to look at that auricular surface to see if it's nice and bubbly, if it's flat, or if it's starting to get holes and degeneration. So it's just starting to degenerate. So they're probably under 40. And then again, we go back to our pubic symphysis, that joint where the two halves of the pelvis join. We'll compare it against our standard criteria, and that will indicate that he's likely aged between 36 and 45 at the time he died. And as I said, osteological analysis, we needed to investigate why his ribs were in a different position than what we expect to happen. So we did a very close investigation of each and every bone. And what really became clear is that he did have pathology. His bones were reacting to something, but it wasn't only located in his ribs. But on his ribs we could see that there is new bone forming. Don't know if you can see, but there's a brown, kind of light gray line on the insides of his ribs, just on the right side, the ones that were sitting weird. And that shows that there's some kind of inflammation of his lung. So there's kind of an infection in there that was getting into the bone. But and that only affected the right side. But that kind of new bone formation was on most of the other elements in the skeleton too. You can see that bone forming in his lower leg. It's in his toes. There's bits on his femur, so his thigh bone. His upper bones. But at this point, we don't know what is causing this. So what we need to do is we make a map of exactly what bones are affected by this new bone growth. We need to do lots of x-rays. So that will be the next stage of analysis for this individual. We need to work out what's happening inside his bones. It's possible, and maybe likely, that he has some form of cancer. So he had maybe like a large tumor in his chest, but the rest of his body was reacting too. So we need to really pinpoint what is being affected and why. But the one thing that we do know for sure is that shortly before he died, skeleton 823, he broke the end of his fibula, so the small bone on the outside of his right leg. And so we can see that the bone is starting to remodel around it. The skeleton's trying to fix itself from that breakage. So during excavation, the two individuals that excavated this grave are doctors, medical doctors from Germany. And it's been really interesting because they went through the whole process of discovering the skeleton. They helped to wash the remains once they were removed from the ground. And we've had a quick look together of the different changes to the bones. And so although they're back in Germany and we're here in Reading, we're working together to try and piece together what has happened to skeleton 823 and just to tell a bit more about his life. It's nice when you can follow the whole archaeological process with somebody. This is skeleton 1116, and she was a bit of a surprise when we were excavating. We knew that there's going to be a skeleton at the base of a grave, but as we came down onto the expected skeleton, we encountered this individual. So you can see in the grave, she was really quite tiny compared to the first two men that we excavated. When you encounter a smaller skeleton, initially you think, oh, maybe it's a child. But as we talked before, all of her long bones had been fully developed. So she was quite small in size, but she was an adult. So osteological analysis, we did everything that we've done before. So we checked for sex. We can't just naturally assume that it's going to be female just because they're smaller in size, although it is more common for female skeletons to be small. So we looked at the forehead, and it's quite fragmented, so we will piece it back together eventually. But we look at the same features, so we look for the eyebrow ridges. And in skeleton 1116, there aren't any. So that's more of a gracile female appearance. We look for that bulge in between the eyes, and it really isn't there. So again, it's more female. When we looked at the mandible, or the lower jaw, we could see that it didn't look quite the same as what we expect mandibles to look like. She's missing all of her teeth. So that could be related to age. But again, her mandible's quite small. And then we move down to the pelvis. As we know, we look at that notch at the back of the pelvis, and it's more broad than we've seen before. You can compare it against a male one. Maybe you can see it's a bit more broad than B-shaped. And then again, we look at the front of the pelvis where the two halves join at the front of our pelvises. Hopefully you can see that it's quite a U shape compared to the V shapes we've been seeing before. So that confirms that it's more likely that she was female. Looking for ways that we could provide an age at death for her. The bones, they weren't very well preserved compared to some of the bigger males that we had. Her bones were very lightweight. They probably looked the same as the other skeletons we've looked at, but if you pick them up and feel them, they're really lightweight. There wasn't any real evidence for pathology like we've seen before, so there wasn't really much trauma. We had evidence of one broken rib that was in the process of healing at the time she died. So the skeleton knew that there was something wrong and it was trying to fix it, but it didn't get the chance to complete the process. We can look at her spine, and you can see that the edges of her vertebral bodies, they got little projections of bone on them. And so this is arthritis, which is quite normal as we get older. We get aches and pains, and our bodies are responding to a lifetime of bending and lifting, and so we get these osteophytes, they're called, on the outsides of our vertebral bodies. The bodies themselves, they're starting to degenerate, so they get little erosive holes, just showing like the normal aging process. But the interesting thing about her spine, while we expect arthritis as we get older, 3 of her vertebral bodies seem to have fractured. Hopefully you can see that the vertebrae, they're not all the same. This one here is kind of wedge-shaped compared to these two. And so that shows that the vertebral body has kind of crushed in on itself. And so that means that her spine would have kind of a forward bend from that point. It's in her, just underneath her rib cage, kind of. And so these kind of crush fractures are quite common in something called osteoporosis. So sometimes as we get old, our bones kind of lose all of their calcium and their strength. And so they're more prone to fractures, which might also account for why they're so lightweight. but there wasn't anything else really pathological with her. So we know that she was probably elderly. She was quite small, and she possibly had osteoporosis. But again, we have to do a bit more research. We have to do some x-rays just to confirm whether that is what is happening here. This is skeleton 965. Now, from the time of excavation, we knew that they were going to be a child. So not only were they really small, we could see that bits of their skeleton hadn't finished growing. But this is the excavation photo. As you can see, they were kind of placed in the bottom of a very deep grave, but nicely placed. So a bit different to the adult skeletons. When we do osteological analysis, we look at lots of different aspects of their skeleton to see what has finished maturing or what has just started maturing. And with children, that growing process and our skeletons developing, it happens at quite a predictable rate. We also pay close attention to the teeth. So I'm sure all of us remember losing our baby teeth, and they get replaced by adult teeth. Again, that whole process, it's very consistent within a year or two within all of us. So we look at all those different markers and we can get quite a narrow age estimate for children. So looking at the skeleton of skeleton 6965, we didn't look to determine like the skeletal sex. It was unlikely that they'd been through puberty, and that's when we can really tell the difference between males and females. So we really focused on age. So again, we start with the teeth. So what you can see from the teeth is that they have all of their adult teeth. So they have all of their incisors, the canine, they've got their premolars, and then the first two molars. We can see hiding inside the jaw is another tooth crown. So that's the wisdom tooth that's still growing. It's not ready to erupt out of the jaw yet. So we know that the person was probably around the age of 15 based on their teeth. However, looking at the rest of their skeleton, as our bones grow, so we can grow both taller and wider, our skeletons grow with us. And so for our bones to get longer, they come in different bits. So here's an upper arm bone. You can see the end is very rugged. It's got a really odd shape, as does the elbow end. And that's because little caps of bone develop separately. Then eventually they'll all fuse together to make our finished adult bone. But until those bits of bone fuse onto the main shaft, we can keep growing taller. And that tends to stop around the age of 18 or 20. But because these caps of bones had started to form, but they're still very separate, our individual was aged probably around 12, maybe a bit younger than 12, based on their body. So why would the teeth tell a different age than the rest of the body? And the answer is that it was likely they've been very poorly for quite a long time. So when children get really poorly, their teeth keep developing at the normal speed for some reason, while the body maturation slows down. So the body puts all of its energy into trying to heal what's wrong rather than grow. But for some reason the teeth keep the normal tempo. So we rely on what the teeth say compared to the body. So this individual was probably around the age of 15 when they died. For pathology, obviously it's not normal, it's not expected for children to die. And so that tends to happen through disease or trauma. So the remains, like we've seen before, there's little areas of new bone formation. There's an odd bump on the inside of his left thigh that's covered in this new bone formation. Again, x-rays will have to be done just to investigate what's happening inside his skeleton. I am saying his. We don't know if they're male or female. It just comes out. But the other striking thing about the skeleton is that the vertebrae, they're very porous. They've got huge openings, which just isn't what we'd expect from a normal growing vertebra. You can see there's light-colored bone forming, so there's some kind of inflammation around their spine that their bones are reacting to. We need to do more research. We need to look at the clinical literature. But it's possible this could be a case of perhaps tuberculosis or something like brucellosis, which is related to living close to livestock or drinking infected milk. But as I said, we do need to do more research. But the most interesting thing about skeleton 6965 is, again, we're going back to his teeth. We can see little deposits of plaque. You know, we brush our teeth every day to remove plaque. But in the past, people didn't take care of their teeth as we do today. So they didn't brush their teeth. They didn't brush the plaque away. So it's left little deposits on his teeth. But interestingly, that plaque is formed on the biting surface of the right side. So usually with every day eating, the plaque just gets brushed away naturally from what we eat. But because there's plaque on the top of the teeth, it means that they weren't able to eat on that side. We can't compare it against the other side because those teeth are missing. But so for whatever reason, they weren't able to chew. There's some thinking that perhaps that's evidence of care. Somebody was making sure that they were able to eat perhaps a soft diet because it's been there for a very long time. So somebody was preparing special food for them to have enough nutrients to fight on with their disease. This is skeleton 1013. He was located slightly towards the more north end of the individual graves. At the time of excavation, he was quite unusual because in this grave he looked really quite skinny. He was really placed in a very compressed kind of body position. But again, in the grave he looked very tall. Again, I'm saying he because just naturally you assume that somebody that's more tall, more robust is going to be male. But again, osteological analysis, we have to double check that. So we've done the same kind of analysis looking for the same traits. So again, the forehead, you can see that his eyebrow ridges are quite pronounced. They're very projecting. A new trait, we can look at the bump that's located behind the ear. It's called the mastoid process. You can feel your own if you touch behind your ear. You should feel a lump. But in males, it's quite big. It's pronounced compared to females. So that's quite a large mastoid process. Again, we look at the pelvis. So again, quite an acute greater sciatic notch. We check under the front of the pubic bone. And again, it's very V-shaped, all suggesting that they were male. When it came to age, again, we look at the teeth. Third molar is there, so they're likely over the age of 21. We look at the long bones, and we can see that it's fully developed. So the top end and the elbow end of this upper arm, they're all fused together. So he would have likely stopped growing. But other bits of his skeleton are showing that he wasn't quite skeletally mature. So we look on the inside of his clavicles, or his collarbones, and we can see that it's quite a rugged area with a little island in the center that seems to be stuck on. And so that's showing that the clavicle hadn't finished developing. And so it doesn't tend to finish until about the age of 30. So that means that he was under the age of 30. And then when you look on the front side of his sacrum, so that's the bottom of your spine, with the pelvis coming around. And we can see these lines in between the vertebrae. So that hadn't quite finished fusing either. So it's estimated that he was age 17 to 25, but likely age 20 to 25, just because his long bones had finished fusing. When it came to looking for pathology, it was all kind of located within his skull. So at the time of excavation, we saw this little hole on the top of his right side of his head. We thought, oh, that's a bit odd, but we didn't really know what it was. But it's related to a pathology of the inside of his skull. So against the front, his forehead, then there's the top of his head. And he has these erosive lesions forming. Again, we don't know what the cause of that is, and we have to do more research in order to really understand what that is and why. But what we do know is that that erosive lesion has gone all the way through to the outside of the skull. This is skeleton 1021, and at the time of excavation, this was a bit mysterious. He, again, was buried directly on top of another individual. And so at the time of excavation, it was difficult to see what belonged to this skeleton compared to what was underneath. It was a bit of a mixed up grave. But what we knew is that we had the upper half of this individual, whereas the bottom half was cut through by another grave. But so it was quite tricky during excavation trying to make sure that we collected the right pieces for the right individual. And this is what was present for osteological analysis. So as always, we need to determine the skeletal sex. So are they more likely male or female? So again, looking at the forehead region, more likely male. The chin, it's called the mental eminence, is quite projecting, it's quite broad, suggestive of a male individual. Looking at the pelvis, again, there wasn't very much to really go on with this fragmented individual, and lots of the necessary bits were missing. But looking at the greater sciatic notch, again, it's more acute, more V-shaped, more likely male. With age, again, there wasn't very much to really go on. A lot of the necessary bits were missing. So we could look at the teeth, and there's some ante-mortem tooth loss. So he lost his first molars a long time before he died. We could look at the auricular surface, and they were quite eroded, but that wasn't through age. It was through taphonomic processes. But it shows that there is some degeneration happening. So he was becoming of advanced age, so likely over the age of 46. At the time of excavation, we did notice something really interesting. Again, there is a hole on the top of the cranium. But this hole was a bit different than the one that we saw in skeleton 1013. It's really round, really well defined, has kind of like a beveled edge on the outside. It goes down to a slightly smaller inner hole that goes all the way through to the inside of the skull. So this is called a trepanation, and it's a medical surgery. It does happen throughout archaeological history. It's been noted in the Bronze Age, Iron Age, Roman times. But this individual has one. Unusually, it's right on the top of the head. which it isn't usually done there because it's usually lethal. It's fatal. There's a blood vessel that runs right through the center of your skull on the inside. And so drilling a hole into there, you wouldn't survive long. But for some reason they've done it. Usually trepanations, you find them on either side of your parietal bones. But related to that trepanation, there's lots of this light-colored new bone formation again, which suggests inflammation or infection. So what we don't really know is whether the trepanation was done to try and heal whatever was happening here, or if that caused this infection. We'll never know. But the body of skeleton 1021 showed lots of different kinds of pathologies too. So we had lots of holes, nice round, smooth lesions that suggest that a soft tissue, something was just sitting in there, like a tumor or a cyst. And we have several examples inside the cranium. There's one at the back of the head. They're just dotted throughout the head. What was also interesting is that his spine, it looks like he had a congenital defect. It kind of looks like two vertebrae have fused together for each of his thoracic vertebrae. So the vertebrae that run down where the ribs are. They have these funny little depressions on the back. It kind of looks like two have fused together during development. They haven't, because he's got the normal number of vertebrae. But it's quite unusual to see that. So again, we need to do a bit more research to see, is this documented medically? What is it called and what does it do to the person? Another interesting thing on the skeleton of 1021 was on the ischium, so it's the bit of the pelvis that you sit on. There's this erosive lesion here. Now, in this location, an erosive lesion, it might suggest that the person was being cared for. And that is because it's possible that something like this is caused by a bed sore. So let's say you haven't moved for a very long time and you get little infections, infected spots on the pressure points where you're laying or sitting. If they're severe enough, they can get their way into your bones. Perhaps what we have here. So as I said, it could be an indication of care. Somebody must have been taking care of this individual in order for these to happen. As you can see, all the bones of a skeleton are not here for skeleton 1021. And that's because the legs were removed by a later grave, being put in on top of this grave. So at the time they're digging the second grave, they happened upon the legs and they removed them and then placed them somewhere else within the area so they could put in their later grave. So as you can tell, that we've done the very basic first analysis of the skeletons. So we know how old they were when they died. We know if they were male or female. We have the very first insights into pathology, but this is only just the beginning of the analysis that we need to do. So we need to look into the clinical literature. So modern medicine, how can that help us diagnose some of these lesions that we're seeing? We need to have a look inside the bones and the chemicals. We need to know where these people were coming from. So we'll look at the isotopes, hopefully, to see if they were local or were they coming from further afield. We also hope in the future to do ancient DNA analysis. So that will help us look at any kind of family relationships between the individuals, if there is any. And it might even help us identify what kind of diseases these people were suffering from.